The COVID-19 pandemic has officially killed more than 4 lakh people in India, making it the third country after the US and Brazil to cross this grim milestone. Yesterday saw more than 850 deaths. We have seen the daily death toll cross the 1,000 mark for the last few days. In the past couple of weeks, deaths have been declining since crossing the 4,000 mark in a 24-hour period during the peak of the second wave. Now, daily cases do remain below the 50,000 mark for the 5th consecutive day. If you look at the all India data, cases have not been rising, but they're not falling either. Daily infections have remained stubbornly between 45,000 to 50,000 for the last few days. Now, Kerala is the only state reporting more than 10,000 daily cases, followed by Maharashtra at 9,700 infections. That's the latest as far as the COVID count is concerned. Now, let's talk about vaccinations. The pace at which India is inoculating its citizens has also seen a sharp drop. June 21st saw a new phase in the vaccination drive, with the central government taking over vaccine procurement and distributing vaccines to states just as it did at the start. Now, that day, we saw a record inoculation of 90.8 lakh doses, almost 91 lakh. That week, we saw vaccines being administered at a steady pace, touching 60 lakh almost every single day, as you can see, between the 23rd and the 26th of June. But this week has seen a significant drop. In fact, except for Monday, the daily inoculations have been below the 50 lakh mark every other day this week, and that tells you the story. Between the 21st of June and the 25th of June, on an average, we were doing 66 lakh, and that's down to 37 lakh between the 28th of June and the 2nd of July. That is the average that we have now seen as far as the last 2 weeks are concerned. The data for July 2nd is till 3 o'clock in the afternoon. Now, Madhya Pradesh, this was the state that was the runaway leader when India reported record-breaking daily inoculations. MP had seen more than 17 lakh shots on the 21st of June being administered, but since then it's managed to cross the 10 lakh mark only twice. Madhya Pradesh does COVID vaccinations only on 4 days a week. The other days are reserved for child immunization. So that is the latest data of 9.9 lakh on the 1st of July. Karnataka has seen nearly 12 lakh inoculations on the 21st of June, but it has not been able to replicate that since. And yesterday, it's seen just under 2 lakhs. So that's the kind of drop that we've seen, about 84%. Let's move now and talk about Punjab. It's also seeing a drop of over 80%, with just under 20,000 doses administered yesterday. Bihar has seen its pace of vaccinations drop by 67%, from 6.4 lakh down to 2.1 lakh. Now, when you compare yesterday's numbers with the 21st of June, this is the picture that emerges. The picture is similar across many states. Haryana has seen its pace of vaccination drop by 65%. The state had reported more than 5.4 lakh inoculations on the 21st of June, but yesterday daily inoculations are down to about 1.9 lakh. Tamil Nadu's pace is down 55%. Assam has seen a drop of about 50% as well. Other large states like UP, Gujarat and Maharashtra have also seen a drop in the vaccination numbers this week compared to last week. UP has seen a drop of 54%. For the state of Gujarat, the vaccination data shows a drop of 46%. For Maharashtra, it's down 30%. The vaccination data is also shedding light on the widening gender gap in the country. 55% of all vaccine doses have been administered to men, crossing 18 crore inoculations. Women account for the remaining 45%, which is a little over 15 crore inoculations. By far, Covishield continues to be the most used vaccine, with nearly 88% of all dosing being administered so far. That is how high the number is and how high the dependence is on one particular vaccine. Covaxin accounts for just over 12%. Less than 1 lakh doses of the Sputnik vaccine have been administered. Remember, Sputnik is still not rolled out for commercial launch. This is the number as far as the pilot launch is concerned. So this is the picture as far as the current vaccination trends are concerned. To take this discussion forward, we're now joined by Dr. Samiran Panda, the head of the Epidemiology and Communicable Diseases Division at the ICMR. Also with us on the show is Riju M. John, health economist. Dr. Panda and Mr. John, many thanks for joining us here on CNBC TV18. Dr. Panda, let me start by asking you, we just took our viewers through what the story looks like as far as vaccination is concerned. We're back down this week to an average of about 37 lakh inoculations a day. This is a far cry from the asking rate of 50 lakh plus and the target of being able to do 1 crore at some point in July. That is what the NTAGI as well as the ICMR and the government are hoping for. Do we continue to be constrained on account of low supplies? I mean, the Covaxin numbers tell the story about supply constraints.
Well, vaccine and the vaccination rate as a public health strategy should not be seen in isolation. We are currently using the vaccination as a rapid response to the pandemic. So a rapid vaccination drive is to be effectively respond to the pandemic, which is not yet over and gone from within the country, from India. So I would say that, yes, this is worrisome, that the vaccination rate is dropping. But what is good news is that the number of infections, although they are not coming down, those numbers are not coming down, but they're remaining kind of stagnant. What does this mean? This means that the acute infections are acutely infected individuals. While they are becoming all right, almost equal numbers are getting infected. So maybe one person is just infecting another and the previous person is becoming all right. So that situation is something where we say or indicate it by saying RO, or the reproductive number, or the rate of transmission as 1. So one individual is transmitting the infection to another individual. But if one individual transmits it to 2 or 3, we could expect the infection to go up. So the upwardly going graph would have been a matter of concern. So what I would say, that this whole stagnation in the new infections getting detected is indicative of some protective behavior that is being observed by people, which is a good news. So the non-pharmaceutical intervention or non-pharmacologic interventions, by which we mean the maintenance of the safe distance or usage of masks or avoidance of mass gathering, all these are working. So that's why we are seeing a stagnation in the number where RO is 1 and one infected individual is infecting just another, not 2, 3, or 4. On the other hand, in order to gain as much as possible from these protective measures, we should have the vaccination drive also maintained at a high level, because this is a disease-modifying vaccine. So it is not an infection-preventing vaccine. So by disease-modifying, we mean that if I get vaccinated or anyone gets vaccinated, then following infection, the person will have less chance of going to the advanced stage of the disease or getting hospitalized or requiring oxygen or even the unfortunate events of death. So that's why it is so very important. If we really do not want the healthcare system to be again burdened, we need to take care of the vaccination drive going up.
You're right, and that is where my question was addressed at, the supply constraints, because, we were given to understand that at least by the end of June, in the month of July, we could see supply easing considerably. But if you look at what the data is telling us, there is an over-reliance on one vaccine, which is Covishield, accounting for almost 87% of all inoculations done in the country so far. And Covaxin is still at 12%. Sputnik, the commercial launch, has been postponed or delayed on account of several issues related to the import consignments and so on and so forth. And the other vaccines like Moderna, etc., we still have no clarity on when these donated vaccines will come and what the quantum will be. So given that, and given the fact that the ICMR is a partner with Bharat Biotech in Covaxin, can you tell us what we should realistically expect in terms of monthly supply from July?
Yes, Shireen, that's a very important question. And I would say that let us not only look into the expectation, because that is not